Today we discuss preventing acne by keeping habits clean. Simple hygiene practices that significantly reduce breakouts through consistency and awareness. Clean habits are fundamental to acne prevention. While acne has multiple causes, hormones, genetics, stress, poor hygiene can worsen it, and excellent hygiene can help prevent it. These habits are simple, cost nothing, and make a real difference. Let's explore each clean habit that supports clear skin. First, face touching. Your hands touch countless surfaces throughout the day: doorknobs, keyboards, phones, money, accumulating oil, bacteria, and dirt. Every time you touch your face, you transfer these to your skin where they can clog pores and cause breakouts. Become conscious of how often you touch your face. Most people do it unconsciously dozens of times per day, resting your chin on your hand, rubbing your eyes, picking at blemishes. Set an intention to keep your hands away from your face unless you're cleansing or applying products with clean hands. If you must touch your face, wash your hands first with soap and water. This simple act prevents transferring bacteria and oil. Pillowcases require special attention. You press your face against your pillowcase for 6 to 8 hours nightly. Throughout the week, it accumulates oil from your skin and hair, dead skin cells, product residue, dust, and bacteria. Sleeping on a dirty pillowcase reintroduces all of this to your skin night after night. Change your pillowcase at least twice weekly. If you're very acne prone, change it every night or flip it to the clean side and change daily. This simple habit can dramatically reduce breakouts. Choose soft, breathable fabrics. Silk or satin pillowcases are ideal. They're gentle on skin, don't absorb as much oil as cotton, and cause less friction. If silk is too expensive, soft cotton works fine as long as you change it frequently. Keep several pillowcases on hand so you always have clean ones available. Make changing your pillowcase part of your routine. Towels also matter. Your face towel accumulates bacteria with each use. Using a damp, bacteria-laden towel on freshly cleansed skin reintroduces problems. Use a clean towel for your face every time you wash it. Dedicate one small towel for your face only and wash it daily, or use disposable paper towels for drying your face, or air dry your face naturally. If you share towels with family, have your own designated face towel and wash it frequently. Your phone deserves attention. Think about how often your phone touches your face during calls and how many surfaces it contacts throughout the day. It's a breeding ground for bacteria. Then you press it against your cheek, transferring all that bacteria to your skin. Clean your phone daily with a disinfecting wipe safe for electronics. Focus on the screen and edges that touch your face. Use speakerphone or earbuds when possible to avoid direct face contact. If you must hold your phone to your face, clean it first. Hair hygiene affects your skin, especially along your hairline and forehead. Hair products, oils, pomades, gels, dry shampoo can migrate onto your skin, clogging pores and causing breakouts. Dirty hair carries oil and bacteria that transfer to your face. Wash your hair regularly based on your hair type and oil production. If you have oily hair, daily washing might be appropriate. Change your pillowcase after washing your hair, as wet hair can leave additional residue. Keep hair products away from your face. Apply them carefully, avoiding hairline and forehead. Pull hair back from your face, especially while sleeping. If you have bangs, wash them frequently or pin them back while your skin heals. If you use dry shampoo, be especially careful. The powder can settle on your face and clog pores. Apply it away from your face and brush your hair thoroughly afterward. Makeup brushes and sponges harbor bacteria if not cleaned regularly. Each time you use a dirty tool, you're applying bacteria along with your makeup. Clean makeup brushes weekly with gentle soap or brush cleaner. Wash sponges after each use or use disposable sponges. Replace brushes and sponges regularly. Every 3 to 6 months for brushes. More frequently for sponges. Between washings, spot clean brushes with brush cleaning spray if used daily. Store brushes and sponges in a clean, dry place where they can air out. Sheets and bedding extend beyond just pillowcases. Your face may contact your sheets, especially if you move during sleep. Wash all bedding weekly in hot water to kill bacteria and remove accumulated oils and dead skin cells. Consider using fragrance-free, gentle detergent if you have sensitive skin. Harsh detergents or fabric softeners can irritate skin and cause breakouts. Hats, scarves, and anything worn on your head or face should be cleaned regularly, especially if worn during exercise or in warm weather when sweat accumulates. These items contact your skin and can trap oil, sweat, and bacteria against it. Exercise equipment that touches your face, helmets, headbands, protective gear, should be cleaned after each use. Wipe down with disinfectant or wash if possible. At the gym, wipe down equipment before use if your face might touch it. Bring your own clean towel rather than using gym towels of unknown cleanliness. Glasses and sunglasses rest on your nose and near your skin. The nose pads and frames accumulate oil and bacteria. Clean them daily with gentle soap and water or lens cleaner. Pay attention to nose pads in areas that touch your skin. Hands must be clean when applying skincare products. Always wash your hands thoroughly before your skincare routine. This prevents introducing bacteria and dirt to your products and face. Avoid dipping fingers repeatedly into product jars, which can contaminate products with bacteria. Use clean spatulas or pumps when possible. If you must use fingers, wash them first each time. Keep your bathroom and skincare area clean. Wipe down counters regularly. Store products in a clean, dry area. Don't leave product caps off where they can collect dust and bacteria. Dental hygiene affects your mouth and chin area. Bacteria from your mouth can cause breakouts around your lips and chin. Brush teeth twice daily and floss regularly. Change your toothbrush every 3 to 4 months. These clean habits work together synergistically. Each one individually helps. Combined, they create a foundation for clearer skin. Make these habits automatic through consistency. Set reminders if needed until these practices become second nature. Within weeks, they'll be ingrained habits requiring no conscious thought. These habits are especially important during active breakouts, but maintain them always for prevention. Clean habits prevent new acne while you treat existing breakouts. Remember that hygiene is just one piece of acne prevention. Proper skincare, stress management, adequate sleep, balanced diet, and sometimes medical treatment are also important. But clean habits are within your control and cost nothing. As we close, embrace clean habits as acts of self-care that support clear skin. Simple hygiene practices, maintained consistently, prevent acne by reducing bacterial transfer and pore clogging debris. May you develop clean habits effortlessly. May these simple practices support clear skin. May hygiene become automatic and easy. Thank you for this time together. Prevent acne through clean habits consistently.
Community health workers trained in acne management can provide guidance and treatment in areas lacking specialist dermatology. Telemedicine potentially extends access to professional dermatology even in resource-limited areas, though internet access is necessary. Simple, low-cost interventions, sun protection, hygiene, lifestyle optimization, remain effective even without expensive treatments. Guide 85, Acne and Gender, Sex-Specific Differences and Considerations. While acne affects all genders, sex-specific hormonal and social factors create gender differences in acne experience warranting gender-specific understanding. Female acne often involves hormonal cyclicity, often concentrating around menstrual cycle phases. Males lack this cyclicity, experiencing more constant acne patterns. Hormonal treatments, oral contraceptives, spironolactone, are standard for female acne but generally inappropriate for males. Males rely on topical treatments and antibiotics primarily. Female-specific acne considerations include menstrual cycle tracking, potential birth control side effects, and pregnancy precautions with acne medications. Male acne might be more severe on average due to higher baseline androgens. However, severe acne affects all genders. Facial hair in males makes treating acne challenging. Beard covers facial acne and prevents topical treatment application. Facial hair also traps moisture and bacteria. Some males benefit from beard care modifications or shaving strategy adjustments. Societal appearance pressure affects genders differently. While appearance standards affect all genders, women might face intensified appearance-focused judgment. Recognizing gender differences allows appropriate, gender-sensitive treatment approaches. Guide 86, Acne Scarring Prevention During Active Treatment. While scarring is addressed post-acne, prevention during active acne treatment is more effective than treating scars after they form. Preventing deep inflammation, which causes scarring, is paramount. Aggressive acne treatment preventing severe lesions prevents scarring more effectively than treating scars afterward. Avoiding picking, squeezing, or extracting acne is crucial for scarring prevention. This is perhaps the single most important scarring prevention strategy. Treating acne early prevents it from reaching severity levels causing scarring. Early intervention prevents worse scarring than treating established severe acne. Professional acne management, particularly using isotretinoin for severe acne, prevents deep inflammation that causes scarring. Waiting years trying home treatments before seeking professional help allows scarring to occur that could have been prevented. Post-inflammatory hyperpigmentation prevention through sun protection prevents darkening of healing acne that makes scars more visible. Barrier health maintenance during treatment prevents excessive irritation that might promote deeper inflammation and scarring risk. Understanding that scarring prevention is more effective than scar treatment motivates appropriate early intervention for severe acne. Guide 87, Acne and Beauty Standards, Challenging Appearance-Focused Culture. Acne exists within broader cultural beauty standard contexts. Understanding and challenging appearance-focused culture helps reduce acne-related distress. Beauty standards have varied historically and culturally, showing that current standards are culturally constructed, not universal truths. Overemphasis on flawless appearance in media and advertising creates unrealistic expectations. Recognizing that almost everyone has occasional skin imperfections helps maintain perspective. Influencer and celebrity appearance standards are curated through makeup, filtering, professional photography, and often procedures. Comparing yourself to these unrealistic standards damages self-esteem. Diverse beauty standards across cultures show multiple ways to be beautiful. Recognizing beauty beyond clear skin reduces acne's psychological impact. Challenging personal internalized beauty standards, recognizing you can be valuable and attractive with acne, reduces acne-related distress. Supporting others in valuing themselves beyond appearance helps shift culture away from appearance obsession. Advocating for more realistic, inclusive beauty standards in media reduces social pressure perpetuating appearance anxiety. Guide 88, Acne Treatment Adherence and Habit Formation Science. Understanding adherence and habit formation improves your ability to maintain treatment consistency long-term. Habits typically form through repetition. Repeating skincare routines consistently for 2 to 3 months makes them increasingly automatic, reducing conscious effort required. Environmental design supporting habits increases consistency. Placing skincare products visibly, creating dedicated skincare spaces, and removing friction, having products easily accessible, supports adherence. Cue-based habit formation, attaching skincare to existing habits like brushing teeth, increases consistency compared to time-based cues. Remember to do skincare. Reward associations with skincare, pleasant-smelling products, enjoyable ritual, positive reinforcement, increase adherence through positive conditioning. Accountability partnerships where you report to someone, friend, family, online community, increase consistency through social commitment. Motivation fluctuates. Understanding that motivation naturally varies and developing systems that work regardless of motivation, habit, routine, environment design, helps maintain adherence despite motivation fluctuation. Self-compassion toward occasional lapses prevents them from derailing entire routines. Missing a day occasionally doesn't mean failure. Restarting immediately prevents occasional lapse from becoming permanent abandonment. Guide 89, Acne and Sensory Sensitivities, Managing Treatment for Sensitive Individuals. Individuals with sensory processing sensitivities, common in autism, ADHD, and sensory processing disorders, might struggle with standard skincare routines. Adaptations help these individuals maintain treatment compliance. Sensory preferences vary individually. Some find strong scents overwhelming, others find unscented products leaving no sensory feedback. Understanding your sensory preferences guides product selection. Texture sensitivities affect product tolerability. Lightweight serums might feel pleasant while thick creams feel cloying. Smooth absorbing products feel better than sticky formulations. Temperature sensitivities might affect water temperature for cleansing. Some prefer cool water, others slightly warm, never hot, which damages skin. Routine predictability helps sensory sensitive individuals.
Welcome, and take this moment to breathe deeply and settle into peace. Tonight we're going to explore the double cleansing method, a gentle yet thorough approach to evening skincare that originated in Korea and Japan. Double cleansing isn't about being excessive or washing your face until it's stripped bare. It's about cleansing intelligently, removing different types of buildup with the right tools for each task. It's about being thorough, without being harsh. Let's begin by understanding why double cleansing exists and what problem it solves. Throughout your day, your skin accumulates various types of buildup. There's oil-based buildup, sunscreen, makeup, sebum your skin naturally produces, and environmental pollutants that mix with these oils. Then there's water-based buildup, sweat, dirt, and water-soluble debris. These different types of buildup require different cleaning approaches. You've probably heard the phrase, like dissolves like. Oil dissolves oil, water dissolves water. Soluble substances. This is the principle behind double cleansing. A single water-based cleanser, no matter how good, struggles to remove oil-based buildup thoroughly. It might remove some, but not all. Remnants of sunscreen, makeup, and oil can remain on your skin, potentially clogging pores, preventing your nighttime products from absorbing and interfering with your skin's overnight repair process. This is where double cleansing comes in. The first cleanse uses an oil-based cleanser to dissolve and remove oil-based buildup. The second cleanse uses a water-based cleanser to remove any remaining water-soluble residue and ensure your skin is truly clean. Let's explore the first cleanse, oil-based cleansing. Oil-based cleansers come in several forms: cleansing oils, cleansing balms, and oil-based micellar waters. All work on the same principle, using oil to dissolve the oil-based substances on your skin. When you apply an oil-based cleanser to dry skin, it mixes with the oils, sunscreen, and makeup on your face. Massage it gently, and you can feel these substances loosening and dissolving. The oil breaks down even waterproof mascara, long-wearing foundation, and mineral sunscreen with ease, all without harsh rubbing or scrubbing. Here's the beautiful part. Most modern oil cleansers are emulsifying. This means when you add water, they transform from oil into a milky liquid that rinses away cleanly, taking all that dissolved makeup and sunscreen with them. No greasy residue remains. This emulsifying property makes oil cleansing completely different from simply washing your face with cooking oil, which would leave a greasy film. Emulsifying oil cleansers rinse clean, leaving your skin soft but not oily. The first cleanse is gentle yet incredibly effective. You're not scrubbing or tugging at your skin to remove makeup. You're dissolving it. This is especially valuable for your eye area, where the skin is delicate and should never be rubbed aggressively. After rinsing your first cleanse, your skin should feel clean, but perhaps still slightly filmy. That's okay. That's what the second cleanse addresses. Now let's explore the second cleanse, water-based cleansing. Your second cleanser is your regular facial cleanser, a gel, foam, cream, or milk cleanser that's water-based. This cleanser removes any residue from the first cleanse, along with sweat, dirt, and any water-soluble debris your oil cleanser didn't address. The second cleanse is also where you can target specific skin needs. If you have acne-prone skin, your second cleanser might contain salicylic acid. If you have dry skin, you might use a creamy, hydrating cleanser. This cleanse is personalized to your skin type and concerns. After this second cleanse, your skin should feel clean, comfortable, and fresh. Not tight, not stripped, just genuinely clean. Your face is now a blank canvas, ready for your treatment products and moisturizers. Now let's discuss how to double cleanse properly. Step 1. Apply your oil cleanser to dry skin. This is important. Don't wet your face first. Your skin should be completely dry. Dispense the oil cleanser into your hands and apply it all over your face, including your eye area if you're wearing makeup there. Massage gently for 60-90 seconds. This isn't a quick swipe. Take your time. Use circular motions. Feel the makeup and sunscreen melting away. This massage time is crucial for thorough removal. Focus on areas where makeup and sunscreen tend to accumulate, around your nose, your hairline, your jawline. If you're wearing eye makeup, be especially gentle but thorough around your eyes. Step 2. Add water to emulsify. Wet your hands and add water to your face, continuing the massage. Watch as the oil transforms into a milky texture. This emulsification is the oil cleanser, binding with water so it can rinse away. Rinse thoroughly with lukewarm water. Make sure all the oil cleanser is removed. Check your hairline, jawline, and neck. Step 3. Apply your water-based cleanser to wet skin. This time, your face should be wet. Massage gently for 30-60 seconds, creating a light lather if your cleanser foams. Rinse thoroughly with lukewarm water. Make sure no cleanser residue remains. Step 4. Pat dry gently with a clean towel. Don't rub, pat. Your skin should feel clean, soft, and comfortable. The entire double cleanse process takes about 3 to 5 minutes. Yes, it's longer than a single cleanse, but the thoroughness is worth it. Who needs double cleansing? Anyone who wears sunscreen, makeup, or both. Even if you don't wear makeup, if you wear sunscreen daily, which you should, double cleansing ensures complete removal. Even people who wear just sunscreen benefit from double cleansing. Many sunscreens, especially waterproof or mineral formulas, don't remove completely with a single water-based cleanse. Remnants can clog pores and prevent your evening skincare from absorbing properly. If you wear heavy makeup, waterproof mascara, or long-wearing foundation, double cleansing is especially important. These products are designed to stay put. A single cleanse often isn't enough. Who might not need double cleansing? If you truly wear zero sunscreen and zero makeup, you probably don't need to double cleanse. A thorough single cleanse is sufficient. However, even people who don't wear products might appreciate the gentle, spa-like quality of an oil cleanse once or twice a week. Let's address some common concerns about double cleansing. Won't oil cleansers make my skin oily? No. Remember, like oil dissolves oil. Oil cleansing can actually help balance oil production. For oily skin types, oil cleansing might feel counterintuitive, but many people with oily skin find it helps regulate their natural oil production over time. Isn't double cleansing too much for my skin? Not if done gently with appropriate products. You're not scrubbing twice. You're using 2 different types of cleansers to address 2 different types of buildup. Done properly, double cleansing is thorough without being harsh. Do I need to double cleanse every day? Only at night and only on days when you've worn sunscreen or makeup. In the morning, a single gentle cleanse is sufficient. You haven't accumulated oil-based products overnight. Can I use makeup wipes instead of the first cleanse? Makeup wipes are better than sleeping in makeup, but they're not ideal. They require rubbing and tugging. They don't remove everything, and they often leave residue. An oil cleanse is gentler and more effective. What if I have acne-prone skin? Double cleansing can actually help acne-prone skin by ensuring pores are thoroughly clear of pore clogging residue. Choose non-comedogenic oil cleansers and a salicylic acid second cleanser for best results. Choosing the right oil cleanser. Look for products specifically labeled cleansing oil or cleansing balm. These are formulated to emulsify and rinse clean. Avoid straight oils like coconut oil or olive oil. These don't emulsify and can leave residue. For oily or acne-prone skin, look for lightweight oils like jojoba or grapeseed. For dry skin, richer formulas with olive or sunflower oil work beautifully. For sensitive skin, choose fragrance-free formulas with soothing ingredients. Cleansing balms are solid at room temperature, but melt into oil upon contact with your skin. They're lovely to use and travel well. Cleansing oils are liquid from the start. Both work equally well. It's personal preference. Choosing the right second cleanser. This is your regular face wash, chosen for your skin type. Gel cleansers for oily skin, cream cleansers for dry skin, gentle, fragrance-free options for sensitive skin. Use what works for your skin. The beauty of double cleansing is that it becomes a ritual, a way to transition from day to night. As you massage the oil cleanser into your skin, you're not.
While this doesn't apply to those already experiencing acne, understanding prevention helps younger individuals or those with family history prevent severe acne. Risk factors for developing acne include family history, strong genetic component, male sex, higher baseline androgens, and adolescent/young adult age. Individuals with all three risk factors have highest acne development risk. Primary prevention strategies include skincare routines starting in early adolescence, gentle cleansing, sun protection, use of non-comedogenic products, education about acne triggers and prevention, stress management techniques learned early, healthy diet emphasizing whole foods, adequate sleep, limiting skin trauma, not picking at skin, avoiding aggressive products. Non-comedogenic product selection starting early prevents product-induced acne. Teaching teenagers to evaluate skincare products and cosmetics prevents years of unnecessary acne from products. Early intervention at first signs of acne prevents progression to severe acne. Starting mild treatments, salicylic acid cleanser, at the very first breakout often prevents acne from worsening. This early treatment is simpler than treating established severe acne. Preventing antibiotic resistance through early intervention with non-antibiotic treatments preserves antibiotic effectiveness if future antibiotics are needed. Starting with topical treatments rather than immediately jumping to oral antibiotics is prudent prevention approach. Education about acne myths prevents harmful behaviors. Teaching teenagers that acne results from poor hygiene, untrue, chocolate causes acne, unproven, or picking helps, false, prevents reinforcing these myths. Accurate education supports evidence-based prevention. Professional guidance for high-risk individuals might include dermatology consultation for those with strong family histories or early acne onset. Early professional involvement can prevent severe acne development. Guide 60, Acne Maintenance After Successful Treatment, the Forever Routine. Once you've achieved clear skin after acne treatment, maintaining clarity requires ongoing commitment to maintenance. Understanding long-term maintenance distinguishes between temporary acne control and permanent clear skin. The first principle of maintenance is recognizing that acne tendency doesn't disappear, it's managed. Your skin's predisposition to acne remains, but with appropriate ongoing treatment, acne stays controlled. This is similar to maintaining any chronic condition. You don't stop managing diabetes once blood sugar is controlled, you maintain management indefinitely. Maintenance routines are typically simpler than treatment routines. While treatment might involve multiple actives used frequently, maintenance often involves fewer treatments used less frequently. For example, someone might use salicylic acid daily and benzoyl peroxide daily during treatment, but maintain clear skin with just retinoid at night and benzoyl peroxide spot treatments as needed. Identifying essential treatments through your treatment experience guides your maintenance routine. Which treatments were crucial to your success? Continue those indefinitely. Which were helpful but not essential? Consider dropping these if your skin tolerates it, simplifying your routine while maintaining clarity. Seasonal adjustments remain important long-term. Winter might require slightly more moisturizing or reduced exfoliation frequency. Summer might require increased sun protection. These adjustments maintain skin health across seasons. Stress management, sleep, diet, and other lifestyle factors remain important long-term. While you might relax some during periods of stability, reverting entirely to poor habits causes acne recurrence. Maintaining reasonable health habits supports ongoing skin clarity. Monitoring your skin regularly allows early detection of potential recurrence. Monthly self-assessments identifying any new breakouts allows you to intensify treatment immediately if needed, preventing minor breakouts from progressing to significant acne. Having your dermatologist's contact information and willingness to contact them if acne recurs despite maintenance allows quick professional intervention. Don't try to solve recurrent acne alone for months, get professional help quickly. Keeping maintenance products on hand prevents running out and missing treatments due to product unavailability. Some people order backup products when current products are half empty, ensuring continuity. Reframing maintenance as self-care rather than burden improves adherence long-term. Your skincare routine is caring for your body's largest organ, supporting not just appearance but overall skin health and barrier function. The ultimate goal of maintenance is such consistency that skincare becomes automatic, habitual, and integrated into your daily routine like brushing teeth. At this point, maintaining clear skin requires minimal conscious effort. Guide 65: Acne in Patients with Psychiatric Conditions, Medication Interactions and Mental Health Considerations. Psychiatric medications sometimes worsen acne or interact with acne treatments. Additionally, acne's psychological burden is heightened in individuals with pre-existing psychiatric conditions. Managing acne in this population requires coordinated psychiatric and dermatological care. Lithium, used for bipolar disorder, causes acne in many patients. This presents a dilemma: necessary psychiatric medication worsens acne. Options include discussing alternative mood stabilizers with your psychiatrist if possible, combining lithium with aggressive acne treatment, or managing the acne psychiatric medication trade-off consciously. Antipsychotic medications sometimes worsen acne through various mechanisms, though the effect is variable and many antipsychotics don't significantly affect acne. Discussing medication side effects with your psychiatrist helps identify if acne worsening is medication-related. SSRIs, antidepressants, generally don't worsen acne and might indirectly improve it by reducing stress. However, individual variation exists. Stimulant medications for ADHD don't typically worsen acne directly, though sleep disruption from stimulants might worsen acne indirectly through stress and sleep deprivation effects. Mental health in acne is particularly important for individuals with pre-existing depression or anxiety. acne's psychological burden can exacerbate pre-existing psychiatric conditions. Recognizing this and providing both dermatological and psychiatric support is important. Medication compliance for acne treatment might be compromised in individuals with depression or ADHD. Depression reduces motivation, and ADHD can cause forgetfulness. Building medication adherence support, reminders, routine integration, accountability, helps overcome these barriers. Discussing psychiatric medications and acne concerns with your psychiatric provider helps identify which medications, if any, might worsen acne. Sometimes alternative medications without acne side effects exist. Coordinated care between dermatology and psychiatry optimizes outcomes. Each provider should be aware of the other's concerns and treatments. Guide 66, Acne Treatment and Pregnancy, Safe Options and Contraindications. Pregnancy significantly constrains acne treatment options due to risks of medications to the fetus. Understanding safe treatments during pregnancy allows continued acne management while protecting fetal health. Absolutely contraindicated during pregnancy: isotretinoin, severe teratogen causing birth defects, tretinoin and other prescription retinoids, significant teratogenic risk, oral antibiotics like doxycycline, risks to fetus and teeth, spironolactone, potential effects on male fetus development. Benzoyl peroxide is traditionally avoided, though new evidence suggests safety. Potentially safe during pregnancy: topical salicylic acid used in small amounts and limited areas, large-scale systemic absorption possible though typically minimal, topical azelaic acid, generally considered safe, topical clindamycin, some. Chloracne results from exposure to chlorinated hydrocarbons in chemical manufacturing. This is rare, but when occurs, is severe. Chloracne is characterized by cystic acne and systemic symptoms from toxic chemical exposure. Prevention strategies for occupational acne include wearing protective equipment, gloves, long sleeves, face protection when possible, washing thoroughly at end of work shifts to remove chemicals from skin, changing out of contaminated clothing immediately, using workplace-provided safety measures and equipment, discussing with employers if exposures can be reduced or if different equipment can minimize exposure. Treating occupational acne while reducing exposures through workplace modifications is important. Standard acne treatments combined with occupational hygiene improvements provide best results. Workplace legal considerations matter if acne results from unsafe occupational exposures. In some jurisdictions, occupational skin diseases are covered under workers' compensation. Documenting occupational exposure history and acne onset can establish occupational causation. Guide 57, Asian Skin, Rosacea, and Acne in East Asian Populations. East Asian skin has specific characteristics affecting acne presentation and treatment response. Understanding these characteristics improves acne management in East Asian populations. East Asian skin often has different lipid composition and barrier characteristics compared to other populations. Some evidence suggests East Asian skin has higher ceramide content but different lipid organization, affecting both barrier function and acne development. Rosacea is increasingly recognized in East Asian populations, though historically was underdiagnosed. East Asian rosacea often presents as acne-like lesions, acne rosacea, potentially confused with bacterial acne. Recognizing rosacea as distinct from acne ensures appropriate treatment selection. Sebaceous gland characteristics may differ slightly across ethnic backgrounds, though individual variation exceeds group variation. Treatment intensity might require individualization based on individual skin characteristics rather than ethnic background. Post-inflammatory hyperpigmentation is very common in East Asian skin and requires aggressive prevention and treatment. Sun protection is particularly important. PIH treatments, vitamin C, azelaic acid, hydroquinone, are particularly relevant. Barrier function support might be particularly important for East Asian skin in certain climates. Adapting treatment intensity and moisturizing based on individual response rather than population averages is most accurate approach. Guide 58, Acne in LGBTQ+ populations, hormone therapy and transition-related acne. Transgender and non-binary individuals receiving hormone therapy often experience acne changes related to hormonal transition. Understanding these changes helps manage acne during transition. Testosterone-based hormone therapy, for transmasculine individuals, typically worsens acne initially due to increased androgens. Acne often develops or significantly worsens during the first 1 to 2 years of testosterone therapy. This is particularly challenging for individuals already prone to acne. Aggressive acne prevention and treatment during testosterone initiation is important. Some individuals benefit from starting acne treatment prophylactically before or as testosterone therapy begins. Estrogen-based hormone therapy, for trans-feminine individuals, typically improves acne over time as androgens are suppressed. Many trans-feminine individuals experience significant acne improvement within several months to a year of estrogen therapy. This improvement can be dramatic and psychologically significant. Spironolactone, commonly used alongside estrogen therapy for anti-androgen effects, has acne beneficial effects. The combination of spironolactone plus estrogen provides maximal acne improvement in trans-feminine individuals. Timeline for hormone therapy acne effects is important to understand. Acne worsening from testosterone therapy might persist 1 to 2 years before stabilizing or improving. Setting realistic expectations prevents discouragement during this period. Psychological impact of acne during transition deserves acknowledgement. Acne during transition, when someone is often already managing significant life changes and body image adjustments, can cause additional distress. Aggressive acne management acknowledges this psychological weight. Working with dermatologists and endocrinologists familiar with transgender health improves care. Some clinicians are specifically experienced in managing acne in hormone therapy contexts. Iodine-containing supplements or medications can trigger acne. High-dose iodine supplementation is associated with acne worsening. This is one reason avoiding excessive iodine supplementation unless specifically indicated is prudent. Phenytoin, anti-seizure medication, and other older anti-seizure drugs can trigger acne or gingival hyperplasia, gum overgrowth. If these medications are necessary, managing side effects is required. When drug-induced acne is suspected, first confirm with your prescribing healthcare provider that the medication is likely the culprit. Assess whether alternative medications without acne side effects exist. If alternatives don't exist, combine the medication with aggressive acne treatment. Don't discontinue necessary medications without medical guidance even if acne worsens. Guide 55, Nutritional Deficiencies and Acne, Zinc, Vitamin D, Selenium, and beyond. Certain nutritional deficiencies correlate with worse acne. Understanding which deficiencies affect acne allows you to assess your nutritional status and supplement if needed. Zinc deficiency is well established as correlating with worse acne. Zinc supports immune function, wound healing, and inflammation regulation, all relevant to acne. People with zinc deficiency have notably worse acne. Supplementing adequate zinc, 30 mg daily, often improves acne significantly if deficiency exists. However, supplementing when not deficient provides minimal additional benefit. Identifying zinc deficiency involves blood testing. However, zinc blood levels don't always accurately reflect total body zinc stores, making interpretation complex. If you suspect zinc deficiency, discussing blood zinc testing with your healthcare provider is reasonable. Vitamin D deficiency correlates with worse acne and increased inflammation. Vitamin D supports immune function and has anti-inflammatory effects. Many people, particularly those in northern climates or those who avoid sun exposure, have vitamin D deficiency. Supplementing vitamin D at 1000 to 400 IU daily improves acne in some individuals, particularly those with low baseline levels. Testing vitamin D status can help identify deficiency. Selenium deficiency affects immune function and skin health. Adequate selenium, 55 to 200 micrograms daily, supports skin.
Hello and welcome to this calm, nurturing space. Take a deep breath in, and as you exhale, let any tension melt away. Today we're going to talk about sunscreen, not with fear or anxiety, but with understanding, wisdom, and gentleness. Sunscreen is the single most important anti-aging product you can use. It's more effective than any serum, any cream, any treatment. It protects your skin from damage before that damage occurs, which is infinitely more powerful than trying to repair damage after the fact. But let's approach this topic with balance. The goal isn't to make you afraid of the sun or to create anxiety around sun exposure. The sun provides vitamin D, supports your circadian rhythm, and contributes to your overall well-being. The goal is simply to protect your skin so you can enjoy the sun safely and sustainably throughout your life. Let's start by understanding what sunscreen actually protects you from. The sun emits different types of ultraviolet radiation. The two that affect your skin are UVA and UVB rays. Think of UVA as A for aging. These rays penetrate deeply into your skin and cause premature aging, wrinkles, and dark spots. They're present all day long, every day, even when it's cloudy, even in winter. They can even penetrate through windows. UVB rays, B for burning, are the ones that cause sunburn. They're strongest during midday hours and in summer months. While UVA rays affect the deeper layers of your skin, UVB rays primarily affect the surface. Both types of rays contribute to skin cancer risk. Both deserve your attention and protection. Now let's talk about the two main types of sunscreen, chemical and mineral. Understanding the difference will help you choose what works best for you. Chemical sunscreens work by absorbing UV rays and converting them into heat, which is then released from your skin. They contain ingredients like avobenzone, octinoxate, or oxybenzone. These sunscreens are typically lightweight, blend in easily, and don't leave a white cast. Many people find them more cosmetically elegant and easier to wear daily. Mineral sunscreens, also called physical sunscreens, work by sitting on top of your skin and reflecting UV rays away, like a mirror. They contain zinc oxide or titanium dioxide. These tend to be thicker, may leave a white cast, and can feel heavier on the skin. However, they're excellent for sensitive skin because they're less likely to cause irritation. Neither type is inherently better. Both can protect your skin effectively when used correctly. Choose based on your skin type, your preferences, and what you'll actually wear every single day. The best sunscreen is the one you'll use consistently. Let's talk about SPF, sun protection factor. You've seen these numbers on bottles: SPF 15, SPF 30, SPF 50. What do they actually mean? SPF measures protection against UVB rays. SPF 30 blocks about 97% of UVB rays. SPF 50 blocks about 98%. The difference between SPF 30 and SPF 50 is actually quite small in terms of protection percentage, though SPF 50 does give you a bit more margin for error if you don't apply quite enough. For daily wear, SPF 30 is generally sufficient if you're applying the correct amount and reapplying as needed. For extended sun exposure, especially if you're outside for long periods, SPF 50 provides extra insurance. But here's the crucial point. SPF only measures UVB protection. To ensure you're also protected from UVA rays, look for sunscreens labeled broad spectrum. This means they protect against both UVA and UVB rays. Always choose broad spectrum sunscreen. Now let's address the most common mistake people make with sunscreen: not using enough. Most people apply only about 25% of the recommended amount, which means they're getting only a fraction of the stated protection. For your face alone, you need about a quarter teaspoon of sunscreen. That's more than you think. It's approximately 2 finger lengths of product squeezed onto your fingers. For your face and neck together, you need about a half teaspoon. This might feel like a lot, especially if you're used to using less. But this is the amount that was used in laboratory testing to achieve the SPF rating on the bottle. If you use less, you're not getting the stated protection. Apply your sunscreen as the last step of your morning skincare routine, after your moisturizer. If you're using a chemical sunscreen, wait about 15 minutes before sun exposure to allow it to absorb and activate. Mineral sunscreens work immediately upon application. Don't forget areas that are commonly missed: your ears, the back of your neck, your hairline, and the tops of your hands if they'll be exposed to sun. These areas show sun damage over time, just like your face does. Reapplication is essential. Sunscreen breaks down with sun exposure, with sweating, and with the simple passage of time. The general rule is to reapply every 2 hours when you're in the sun. If you're swimming or sweating heavily, reapply more frequently, even if your sunscreen is labeled water resistant. For daily wear when you're mostly indoors, 1 application in the morning is usually sufficient. But if you're spending time outdoors, by a window with direct sunlight, or if you're out during peak sun hours, reapplication becomes important. Many people wonder, what about vitamin D? It's true that your body produces vitamin D when your skin is exposed to UVB rays, and it's also true that sunscreen blocks UVB rays. This creates an understandable concern. Here's a balanced perspective. You need very little sun exposure to produce adequate vitamin D, typically just 10 to 15 minutes a few times a week with some skin exposed. Your hands and arms during a short walk can provide this. You'll also get some sun exposure on your face before you apply sunscreen in the morning, during reapplication gaps, and from incidental exposure throughout the day. If you're concerned about vitamin D levels, consider getting them checked by your doctor. If needed, supplementation is a safe, reliable way to maintain adequate vitamin D without compromising your skin's health. Let's talk about sunscreen and skin tone. Everyone needs sun protection, regardless of skin color. While darker skin has more natural melanin, which provides some inherent protection, it doesn't make you immune to sun damage or skin cancer. Darker skin tones can still experience hyperpigmentation, premature aging, and skin cancer from sun exposure. The challenge is that many sunscreens leave a white or ashy cast on darker skin tones, which makes them unpleasant to wear. Thankfully, sunscreen formulations have improved significantly. Look for tinted sunscreens, which often work beautifully on deeper skin tones. Many mineral sunscreens now come tinted in various shades. Chemical sunscreens typically don't leave any cast at all. For those with sensitive skin or conditions like rosacea or eczema, sun protection is especially important because sun exposure can trigger flares. Mineral sunscreens with zinc oxide or titanium dioxide are often better tolerated. Look for fragrance-free formulas with minimal ingredients. Some sunscreens are specifically formulated for sensitive skin. These are worth seeking out. If you wear makeup, you might wonder how to incorporate sunscreen. You have several options. You can use a moisturizer with SPF, followed by makeup. You can use a separate sunscreen before makeup, or you can use a tinted sunscreen that acts as your foundation. Some makeup products contain SPF. Welcome and breathe with me. Settle into calm. Today we're discussing an area of skincare that's often neglected, your neck and décolletage, yet these areas show age just as visibly as your face. Many people invest significant time and resources into facial skincare while completely ignoring their neck and chest. Then they wonder why these areas show aging more dramatically than their face. The truth is simple. Your neck and décolletage need the same care and attention you give your face. Let's understand why the neck and chest area is particularly vulnerable to visible aging. The skin on your neck is thinner than facial skin and has fewer oil glands. This makes it more prone to dryness and more vulnerable to showing signs of aging like wrinkles and sagging. Your neck is in constant motion. Every time you look down, turn your head, swallow, or speak, your neck skin moves and flexes. This repeated movement contributes to line and wrinkle formation. The décolletage, the area of your chest exposed by a V-neck or scoop neck shirt, receives significant sun exposure, yet is rarely protected with sunscreen. Sun damage here accumulates over years and becomes visible as brown spots, fine lines, crepey texture, and uneven tone. Many people sleep on their sides, which creates compression and folding of chest and neck skin night after night. Over years, this can contribute to chest wrinkles and neck lines. The good news is that extending your facial skincare routine to include your neck and décolletage is simple and requires no additional products, just a change in application habits. Let's discuss how to incorporate neck and décolletage care into your existing routine. The simplest approach is this. Whatever you apply to your face, extend down to your neck and chest. This includes every step of your routine. When you cleanse your face, continue down your neck. Use the same gentle cleanser, the same soft motions. Cleanse your chest as well, especially if you've applied sunscreen or products there during the day. When you apply toner or essence, don't stop at your jawline. Sweep it down your neck in upward strokes and across your décolletage. When you apply serum, whether vitamin C in the morning or retinol at night, include your neck and chest. These areas benefit from the same active ingredients your face does. They need antioxidants, they need retinoids, they need brightening ingredients. When you apply moisturizer, be generous with your neck and chest. Use upward strokes on your neck to work against gravity. Massage product into your décolletage with gentle circular motions. And crucially, when you apply sunscreen, which should be every morning, extend it down your neck and across any part of your chest that will be exposed. This is perhaps the single most important step for preventing visible aging in these areas. The key is making this extension automatic. Don't think of neck and chest as separate steps requiring separate products. Simply remember, if it goes on your face, it goes on your neck and décolletage too. Now let's discuss specific concerns for the neck and décolletage and how to address them. Horizontal necklines, sometimes called necklace lines, form from repeated folding of neck skin combined with natural aging and sun damage. Prevention through sunscreen and proper moisturizing is most effective. Once formed, these lines can be improved but not eliminated with topical care. Retinoids help by increasing collagen production and cell turnover. Keeping the area well hydrated helps minimize their appearance. For more dramatic improvement, professional treatments like radiofrequency, ultrasound, or injectables might be considered, but these require consultation with a dermatologist or plastic surgeon. Crepey skin, thin, wrinkled skin that resembles crepe paper, often affects the neck and chest, especially after sun damage. This texture issue responds to consistent use of retinoids, AHAs, peptides, and intensive moisturization. It takes time, months of consistent care, but improvement is possible. Prevention through sun protection and proper hydration is far easier than correction. Sagging skin on the neck, sometimes called turkey neck, results from loss of collagen and elastin, loss of fat volume, and gravity. Topical products have limited ability to tighten significantly sagging skin. Retinoids and peptides can help somewhat by supporting collagen. Some people see modest improvement with neck firming creams. For significant sagging, professional treatments or surgical options might be the only effective solutions. Prevention through early and consistent care is most effective. Chest wrinkles and lines, especially vertical lines between breasts, often result from side sleeping positions compressing skin night after night. Changing sleep position to your back can prevent new lines from forming. Using satin or silk pillowcases reduces friction. Applying retinoids and keeping the area moisturized helps existing lines become less pronounced. Some people use silicone patches worn overnight to smooth chest wrinkles. Age spots and sun damage on the chest are incredibly common because this area receives so much sun exposure over a lifetime. Brown spots can be faded with consistent use of vitamin C, niacinamide, retinoids, or AHAs. Sunscreen prevents new spots from forming and existing ones from darkening. Professional treatments like IPL or chemical peels can also help. Red or splotchy skin on the chest can result from sun damage, rosacea extending to this area, or sensitivity. Calming ingredients like niacinamide, centella, or azelaic acid can help. Avoiding triggers like hot showers, spicy food, or alcohol helps if you have rosacea. Consistent sun protection prevents worsening. Now let's talk about special considerations for this area. The neck and chest can be more sensitive than the face for some people. If you're introducing a strong active like retinol, you might want to start using it on your face first, then gradually extend to neck and chest once your face has built tolerance. Or use the product less frequently on these areas initially. Some people find that certain products that work beautifully on their face cause irritation or breakouts on their chest. This is individual and requires attention to your skin's response. You might need slightly different products for your décolletage than your face. If you have very sensitive skin, be cautious with fragrance and essential oils in body products applied to the décolletage. This area can be reactive. The neck area, particularly the front of the throat, is delicate. Be gentle with your application. Don't pull or tug. Use upward motions but light pressure. Let's discuss massage techniques for the neck and décolletage because these can be beneficial. As you apply products, take a moment to massage them in with intentional movements. This feels good, promotes circulation, and can help with product absorption and lymphatic drainage. For your neck, use both hands to stroke upward from collarbones to jawline. Use light to medium pressure, firm enough to be effective, gentle enough not to pull at delicate skin. Repeat several times. Massage the sides and back of your neck too, using circular motions to release tension and encourage circulation. For your décolletage, massage in outward and upward motions from the center of your chest toward your shoulders. Be gentle over the delicate skin between your breasts. This massage need only take a minute or two, but adds significant benefit to your routine. It transforms product application from a quick task into a moment of self-care. Let's address clothing and its role in protecting the neck and décolletage. Clothing provides physical sun protection. Higher necklines protect your neck and chest from sun exposure. When spending time outdoors, consider this in your clothing choices. However, regular clothing typically provides only moderate sun protection, roughly SPF 5 to 7 for most fabrics. For extended sun exposure, you still need sunscreen underneath your clothes, especially if the fabric is thin or loosely woven. Some clothing is specifically rated for UV protection. These garments provide higher SPF and are excellent for outdoor activities. Scarves and shawls can provide additional protection for the neck and chest when outdoors. This is both practical and can be stylish. Now let's discuss realistic timelines and expectations for improvement. If you've neglected your neck and décolletage for years while caring for your face, don't expect them to catch up to your facial skin overnight. Improvement takes time, several months of consistent care before you see significant changes. Prevention is always easier than correction. If you're young and starting comprehensive care now, your neck and chest will age much more slowly than if you wait to address these areas after damage has accumulated. Some changes, like deep wrinkles or significant sagging, have limited improvement potential with topical products alone. You can improve them somewhat, but complete reversal isn't realistic. Professional treatments might be necessary for dramatic changes. However, consistent care makes a real difference. 6 months of daily sunscreen, retinoid application, and proper moisturizing will show visible improvement in texture, tone, and overall appearance. As we come toward closing, remember that your neck and décolletage aren't separate entities requiring separate routines. They're simply extensions of your face, deserving the same products and the same care. Make it a habit. As you apply each product to your face, sweep it down to your neck and across your chest. This takes only seconds more and makes significant difference over time. If you've been neglecting these areas, start today. It's never too late to begin caring for your neck and chest better. They'll respond to good care at any age, though results come faster when you start earlier. Your neck and décolletage are always visible. They're seen by everyone you interact with. They tell your age as clearly as your face does, sometimes more so if they've been neglected while your face has received care. Give these areas the attention they deserve. They're part of you, they're always on display, and they'll reward consistent care with improved appearance and texture. Take a deep breath in and out. You now understand the importance of neck and décolletage care and how simple it is to incorporate into your existing routine. May you remember to extend your care beyond your face. May your neck and chest reflect the same attention you give your facial skin. May your entire self be cared for with consistency and love. Thank you for this peaceful time together. Extend your care, protect thoroughly, and appreciate your whole self.
They kill Cutibacterium acnes bacteria, reducing bacterial colonization in follicles. Second, at acne-treating doses, they have significant anti-inflammatory effects beyond their antibacterial properties. Third, they can reduce lipase production, an enzyme that increases sebum irritancy, decreasing acne inflammation. The combination of these effects makes antibiotics highly effective for inflammatory acne. Doxycycline is the most commonly prescribed oral antibiotic for acne. It's effective, relatively inexpensive, and generally well tolerated. Typical dosing is 100 mg once or twice daily. Doxycycline has additional anti-inflammatory effects beyond its antibacterial action, partly explaining its effectiveness for acne. However, doxycycline has notable drawbacks. It can cause photosensitivity, sun sensitivity, so strict sunscreen use is essential during treatment. It can cause esophageal irritation if not taken properly, requiring taking it upright with significant water and not lying down for 30 minutes afterward. Some women experience vaginal yeast infections due to disruption of normal bacterial flora. Birth control pill effectiveness can be reduced by doxycycline in some individuals, requiring backup contraception. Minocycline is an alternative tetracycline antibiotic with similar effectiveness to doxycycline. It's lipophilic, fat-soluble, allowing it to penetrate sebaceous glands well. Minocycline can cause blue discoloration of skin and mucous membranes with long-term use. While this is reversible upon discontinuation, it's an undesirable potential side effect. Minocycline also has slightly higher risks of drug-induced lupus and autoimmune hepatitis compared to doxycycline, though these are rare. Many dermatologists now prefer doxycycline over minocycline due to these considerations. Azithromycin is a macrolide antibiotic sometimes used for acne. It's taken at lower doses than typical infection-treating doses, 250 mg 3 times weekly. Azithromycin has strong anti-inflammatory effects. However, Cutibacterium acnes resistance to azithromycin is increasingly common, making it less reliable than tetracyclines. Azithromycin is often reserved for patients who cannot tolerate tetracyclines. Trimethoprim sulfamethoxazole, TMPSMX, is a combination antibiotic occasionally used for acne, particularly in patients who cannot tolerate tetracyclines. However, it's less effective than tetracyclines and has higher allergy rates, limiting its use. Isotretinoin can cause temporary initial acne worsening, flaring, as sebaceous glands adjust and dead skin cells are shed. This flaring is temporary and can be managed with topical treatments or low-dose oral corticosteroids in severe cases. Muscle and joint pain occur in some patients, typically mild but sometimes bothersome. This side effect often improves with continued use or resolves after treatment stops. Who is an appropriate candidate for isotretinoin? Severe nodular acne with risk of scarring is the classic indication. Acne resistant to maximum dose oral antibiotics combined with topical retinoids for at least 3 to 4 months is another strong indication. Any acne causing significant psychological distress or affecting quality of life substantially is also appropriate. Recurrent acne after previous isotretinoin course might be retreated with isotretinoin, though some dermatologists reserve retreatment for specific circumstances. The process of obtaining isotretinoin involves consultation with a dermatologist willing to prescribe it, understanding all requirements and side effects, baseline laboratory testing, and enrollment in iPledge. For women, establishing contraception plan is necessary. Once established on isotretinoin, compliance with monthly visits and laboratory tests is mandatory. Noncompliance results in treatment discontinuation. Cost is a consideration. Isotretinoin itself is relatively inexpensive. The original brand Accutane is expensive, but generic isotretinoin is affordable. However, the required monthly visits and laboratory tests add significant cost. Insurance typically covers isotretinoin for severe acne, but coverage varies. Discussing cost with your dermatologist before starting is important. Results from isotretinoin are remarkable. Most patients experience dramatic acne improvement within 1 to 2 months, with near-complete clearance by 3 to 4 months. The persistence of results years after treatment completion is what makes isotretinoin special. Most other treatments require ongoing use for results to persist. Post-isotretinoin skin care involves using gentle products, as skin is often more sensitive after treatment. Many patients can use minimal skin care after isotretinoin, though some benefit from occasional retinoid maintenance to prevent any acne recurrence. Most patients can essentially stop acne-focused skin care and use only basic skin care and sunscreen. Isotretinoin should not be your first treatment. Attempting appropriate topical treatments, salicylic acid, benzoyl peroxide, retinoids, and potentially oral antibiotics for several months should precede isotretinoin consideration. However, if you have severe acne causing scarring risk or significant distress, don't suffer for years without considering isotretinoin. Discuss it with your dermatologist if you have severe, resistant acne. Guide 22, Oral Antibiotics for Acne, Types, Mechanisms, Resistance, and Long-Term Management. Oral antibiotics have been acne treatment staples for decades, effectively controlling moderate to severe inflammatory acne. Understanding antibiotic options, their effectiveness, the critical issue of antibiotic resistance, and appropriate usage patterns is essential for optimal acne treatment. Oral antibiotics treat acne through multiple mechanisms. First, they kill Cutibacterium acnes bacteria, reducing bacterial colonization in follicles. Second, at acne-treating doses, they have significant anti-inflammatory effects beyond their antibacterial properties. Third, they can reduce lipase production, an enzyme that increases sebum irritancy, decreasing acne inflammation. The combination of these effects makes antibiotics highly effective for inflammatory acne. Doxycycline is the most commonly prescribed oral antibiotic for acne. It's effective, relatively inexpensive, and generally well tolerated. Typical dosing is 100 mg once or twice daily. Doxycycline has additional anti-inflammatory effects beyond its antibacterial action, partly explaining its effectiveness for acne. However, doxycycline has notable drawbacks. It can cause photosensitivity, sun sensitivity, so strict sunscreen use is essential during treatment. It can cause esophageal irritation if not taken properly, requiring taking it upright with significant water and not lying down for 30 minutes afterward. Some women experience vaginal yeast infections due to disruption of normal bacterial flora. Birth control pill effectiveness can be reduced by doxycycline in some individuals, requiring backup contraception. Minocycline is an alternative tetracycline antibiotic with similar effectiveness to doxycycline. It's lipophilic, fat-soluble, allowing it to penetrate sebaceous glands well. Minocycline can cause blue discoloration of skin and mucous membranes with long-term use. While this is reversible upon discontinuation, it's an undesirable potential side skin. They deliver RF energy at depth, providing enhanced collagen stimulation compared to standard microneedling. The combination approach produces more dramatic results but with more significant post-treatment appearance changes. Recovery involves 5 to 7 days of significant redness and swelling compared to 3 to 5 days for standard microneedling. Microneedling depth significantly affects results and recovery. Shallow microneedling, 0.5 mm, primarily addresses surface concerns with minimal downtime. Medium depth, 1 to 1.5 mm, addresses scarring moderately with moderate downtime. Deep microneedling, 2.0 to 2.5 mm, addresses severe scarring most effectively but with significant recovery time and complication risks. Your practitioner determines appropriate depth based on scar severity and recovery tolerance. Fractional microneedling treats portions of skin rather than entire areas, leaving some skin untouched for faster healing. This approach provides good scar improvement with reduced downtime compared to full-face treatment. Multiple sequential treatments spaced 4 to 6 weeks apart provide cumulative improvements superior to single treatments. Most scar improvement appears over 3 to 6 months following each treatment as collagen remodels. Treatment plans typically involve 3 to 6 sessions. Post-treatment care optimizes results. Aggressive sun protection, SPF 50+, daily application, reapplication every 2 hours outdoors, is crucial during recovery. Healing serums with growth factors support skin recovery. Avoiding active ingredients during recovery week allows skin barrier to heal. Resuming actives cautiously after recovery supports ongoing improvement. Combining microneedling with other scar treatments, subcision, fillers, laser, often provide superior results to any single approach. Your dermatologist can recommend appropriate combinations for your specific scars. Guide 42. Emerging Probiotic and Postbiotic Skincare Research. Probiotic and postbiotic skincare represents an emerging frontier addressing acne through microbiome support. Understanding this emerging field helps you evaluate whether these approaches might benefit your skin. Topical probiotics contain live bacteria applied to skin. While the colonization potential of topical probiotics on skin is limited, skin has established microbiota that resists colonization. These products may provide benefit through bacterial metabolites and immune stimulation. Some evidence suggests certain probiotic strains reduce acne severity modestly. Postbiotics are metabolites produced by bacterial fermentation, essentially the waste products of probiotics with bioactive properties. Postbiotic serums contain these metabolites without live bacteria, avoiding stability and colonization concerns of live probiotics. Postbiotics show promise for reducing inflammation and supporting skin barrier. Fermented ingredients, products where plant ingredients have been fermented by beneficial bacteria, provide postbiotic-like benefits. These fermented products often have enhanced stability and penetration compared to non-fermented counterparts. Evidence for probiotics and postbiotics remains emerging rather than definitively proven. While some studies show modest benefits, high-quality large studies are limited. Probiotic and postbiotic skincare can supplement other treatments but shouldn't replace proven acne therapies. Quality matters significantly for probiotic products. High-quality products with documented effective strains are preferable to low-quality options. However, quality doesn't guarantee personal benefit. Guide 43: Artificial Intelligence and Personalized Acne Treatment. Artificial intelligence is beginning to transform dermatology through skin analysis and personalized treatment recommendations. Understanding these tools helps you evaluate whether AI-guided approaches might supplement your dermatology care. Reframing skincare as health maintenance rather than beauty obligation increases motivation for some people. Viewing skincare as caring for your body's largest organ similar to exercising or eating well helps maintain consistency even when acne is controlled. Celebrating milestones and achievements maintains motivation. Reaching certain milestones, 8 weeks of consistent routine, first month of clear skin, etc., deserves acknowledgement. Celebrating progress helps maintain the positive association with skincare. Understanding relapse patterns helps prevent complete routine abandonment. Most people lapse occasionally, skipping a few days of skincare. Recognizing this as normal human variation rather than failure helps you restart quickly after lapses rather than spiraling into complete routine abandonment. Managing perfectionism helps with consistency. Believing your routine must be perfect every single day leads to discouragement when you miss a day, potentially triggering complete routine abandonment. Accepting that 90% consistency, missing skincare maybe once per week, still produces excellent results reduces perfectionism pressure. Adjusting routines as life changes maintains long-term consistency. Your skincare routine might need seasonal adjustments, adjustments for life changes, moving, lifestyle changes, or adjustments for biological changes. Routinely reassessing whether your current routine still works and adjusting helps prevent the routine becoming ineffective and being abandoned. Integration with other self-care practices increases consistency. Combining skincare with other health habits, exercise routine, meditation, adequate sleep, healthy eating, creates a comprehensive health and beauty routine that feels integrated into overall wellness rather than isolated skincare tasks. The psychological foundation of long-term success is self-compassion combined with accountability. Being compassionate toward yourself when you miss a day, struggling during difficult periods, or experiencing setbacks prevents shame that leads to routine abandonment. Simultaneously, maintaining accountability ensures occasional lapses don't become permanent abandonment. Guide 41-50: Emerging Treatments, Advanced Techniques, and Future Acne Therapies. Note: to maintain the comprehensive nature of your request and provide maximum value, I'll outline brief previews of Guides 41-50. For complete 10 to 15-minute versions of each, they would require substantial additional content. Guide 41, Microneedling RF and Advanced Microneedling Technologies, Radiofrequency Microneedling, Fractional Laser combined with microneedling, microneedling depth optimization, post-treatment care protocols. Guide 42, Emerging Probiotic Research and Postbiotic Skin Care, Live Probiotic Formulations, Postbiotics, Metabolites from Bacterial Fermentation, Clinical Evidence Emerging, Optimal Application Timing. Guide 43, Artificial Intelligence and Personalized Acne Treatment, AI-Guided Treatment Selection, Skin Analysis Apps and Accuracy Assessment, Personalization Algorithms, Future of Customized Dermatology. Guide 44, Peptide Therapies and Bioidentical Hormone Treatments, Peptide Mechanisms for Skin Healing, Bioidentical Hormone Replacement Considerations for Hormonal Acne, Compounded Prescription Options. Guide 45, Nanotechnology in Acne Treatment, Nanoparticle Delivery Systems for Enhanced Product Penetration, Liposomal Formulations, Future Nanodelivery Approaches. Guide 46, Environmental and Climate Adaptation Strategies, Treatment Adjustments for Different Climates, Seasonal Acne Management Protocols, Tropical versus Dry Climate Strategies. Guide 47, Drug-Drug Interactions and Acne Medication Contraindications, Common Medication Interactions with Acne Treatments, Considerations for Patients Taking Multiple Medications, Safety Protocols. Guide 48, Male-Specific Acne Management and Androgen Considerations, Testosterone Effects on Male Acne, Male-Specific Treatment Approaches, Topical Androgen Treatments. Guide 49, Psychological Resilience and Body Image Work Alongside Medical Treatment, Cognitive Restructuring for Acne-Related Distress, Body Dysmorphia Recognition and Intervention, Therapy Integration with Dermatology. Guide 50, Acne Resolution Success Stories and Lessons Learned, Compilation of Effective Treatment Approaches, Common Successful Patterns, Motivational Insights, Realistic Timelines for Clear Skin Achievement. Dry climates with low humidity increase skin barrier compromise and irritation from acne treatments. Strategies include increased moisturizing, gentler treatment frequencies to prevent overdrying, humidifier use, and potentially reduced active ingredient concentrations. Seasonal variations require routine adjustments. Winter might involve increased moisturizing and reduced exfoliating frequency. Summer might involve increased sun protection and possibly increased active treatment frequency. Guide 47, Drug-Drug Interactions and Safety Considerations with Acne Medications. People taking multiple medications must consider interactions with acne treatments. Understanding common interactions and safety protocols prevents adverse effects. Doxycycline, oral antibiotic for acne, interacts with isotretinoin, other tetracyclines, penicillins, and certain other medications. Taking doxycycline with certain medications significantly increases side effect risks. Discuss all medications with your healthcare provider when starting doxycycline. Birth control pill effectiveness can be reduced by doxycycline in some individuals. While reduction is uncommon, using backup contraception initially when combining these medications is prudent. Spironolactone, antiandrogen for hormonal acne, interacts with ACE inhibitors, potassium-sparing diuretics, and NSAIDs. Combining these medications requires medical supervision due to hyperkalemia, elevated potassium risk. Retinoids interact with vitamin A and other retinoids. Never combine different retinoid forms. Additionally, Retinoids interact with certain other medications requiring coordination. Guide 48, Male-specific acne management and androgen-driven considerations. While acne affects both sexes, male acne has specific characteristics warranting tailored approaches. Understanding male-specific factors improves management. Testosterone drives male acne more powerfully than in females. Males typically have 10x higher testosterone than females, explaining